All right, right now we are privileged to be able to take your questions to the expert. Viewers have been sending us questions all day long about coronavirus that they'd like to have answered.
So we bring in Dr. Russ Lampen, the Division Chief for Infectious Disease at Spectrum Health. Thank you so much for joining us today.
Thanks for having me.
Tell us what the situation is like at Spectrum right now with the coronavirus.
Okay, so currently there are no active cases of coronavirus in West Michigan. There are no cases that have been diagnosed at Spectrum Health. So right now at Spectrum, and I think in all the hospitals in West Michigan, the emphasis is on getting prepared. The assumption is that there will be cases here in West Michigan, that there will be more cases in the state, and we want to make sure that we're prepared to deal with them on an outpatient basis, so when people come into their primary care physician's offices, but if people need care on the inpatient side in the hospital, that we're prepared to take care of that influx of patients.
Okay, prepared for that. Carla Hardy asked today, what are some of the initial symptoms? Kind of a basic question, but good to go over. How do we distinguish this from a cold or the flu? Any surefire way to know?
So it is a little difficult. Initially, the symptoms are very similar to having colds. So sore throat, runny nose, maybe a headache, that's where this starts. Where the concern develops is when people develop increasing shortness of breath. So it goes from an upper respiratory infection into a pneumonia where the virus attacks the lungs. And so when people develop fevers, shortness of breath, that's when those symptoms become concerning, and that's when people should seek care and contact their doctors.
So it's that shortness of breath, that
Correct.
upper respiratory. Okay, Becca Joe says, how long are you contagious before showing any symptoms? A similar question from Dawn Cochran Kerwin. What is the average duration of COVID-19 from first symptoms to recovery? So how long are we contagious before we know we have it, and what's the duration?
So most people begin to show symptoms about 5 days after they've been exposed. And so we've talked about these 14-day quarantine windows that have been occurring. So we've not seen people develop infection after 14 days of exposure. So most people within a week of being exposed to somebody ill will start to have those symptoms. Now once somebody's sick, the average duration of symptoms lasts about a week to 10 days. And the duration of being contagious after you're ill is not entirely clear, but as their cough goes away, if they don't have a runny nose, they become significantly less contagious. So this infection is spread by what we call droplet spread. So it's when people cough or sneeze, those little particles that go out into the air, that's what are the infectious particles. And so it's thought that once symptoms improve, that their degree of being contagious or transmitting infection decreases significantly.
Okay. Carly Marie King asks, what about those who are pregnant? Are we at a higher risk of contracting the virus?
No, that's a good question, and I think there's still some unclearness as to how pregnant women will be affected. There's a small study that was done out of China looking at women in their third trimester of pregnancy, and they did not see any increased rates of complications amongst those women. So they did fine. We do know that other respiratory illnesses like influenza tend to affect pregnant women more severely. We haven't seen that, and that has not yet been documented with the coronavirus.
Okay, maybe some good news there.
Yes, Michelle Orzula Baying, if you get coronavirus, can you get it again? That's a good question.
Yeah, I mean, we don't know because this is new, a novel coronavirus. I would anticipate that you would be able to catch it more than once. So coronaviruses, currently there are 4 that we know about that circulate widely and cause the common cold, right? And so people can get the cold every year. It is thought that there would be some partial immunity. So after people contract it, it's expected that if you were to get it again, it would be less severe the next time you contract it.
Not as severe.
Kevin Thomas wonders if the flu shot reduces any of the severity of the virus because maybe they present with both of the similar symptoms.
So this is interesting. So influenza vaccination, obviously it doesn't provide any protection against coronavirus, but it still provides protection against the flu, which we're seeing circulating. And so one of the things that we are encouraging people to do is if you hadn't had a flu shot, go get one. We're trying to keep our hospitals available for people who may contract COVID or coronavirus. And so by keeping yourself healthy and out of the healthcare system, it's another way to avoid coronavirus. So yeah, if you hadn't had a flu shot yet, please go get one. It won't keep you out of the hospital from COVID, but it may keep you out of healthcare system from influenza.
Just staying healthy in general.
Absolutely.
Yeah. Thomas Wiedemann says, I've heard conflicting reports on wearing masks and whether or not they can help provide protection against COVID-19. What is the latest on that? Masks?
Yeah, it seems intuitively that it would be beneficial, but they have not really been shown to prevent people from acquiring infections. So I think typically, even if you have a mask, you're going to take it off at some point. You're going to scratch your nose or scratch your eye, and those are the activities that cause disease to occur. There is benefit for wearing a mask if you're sick. So if you're coughing and sneezing, wearing a mask may keep those droplets from spreading to other people, but they're not protective if you're otherwise healthy. So I don't recommend wearing a mask if you're healthy. Keep those supplies for healthcare workers who are exposed to people for prolonged periods of time, or maybe exposed to individuals during procedures that would induce coughing and make transmission more readily. So anyway, so I don't recommend wearing a mask if you're healthy, and it hasn't really been shown to prevent transmission within a community.
Yajara Chavez says, what can you do to prevent being infected if you're going to be traveling? What measures can you take before and after traveling?
I mean, this is a big question. I think we've just had college spring break finish. A lot of us are looking at spring break plans probably for school students at the beginning of April. I think the things that we can try to do are minimize, obviously, exposure to crowds. So if you can drive your own private vehicle, that's going to keep you less exposed. Think about maybe avoiding things like amusement parks or other areas where there will be large groups of people gathering. Maybe consider cooking your own food as opposed to going out to eat if that's an option for you. Those would be the main things that you can do. Monitoring, obviously, for symptoms of illness upon your return from a trip. If you feel sick, we're encouraging people to stay home. The other things, I think, if you're going to fly in an airplane, if you can use hand sanitizer frequently, probably wipe down those tray tables, wipe down the arms of the airplane. I think that's about all you can do. Be real vigilant about using hand sanitizer and washing your hands as frequently as possible.
Yes, we
Absolutely.
have heard that constantly. Linda Prodzik says, I hear more people are dying from the flu. Are they blowing this out of proportion?
I mean, this is an interesting thing that happens a lot, where people are trying to compare influenza, which is a known entity that we see every year and have in some ways grown comfortable with, to COVID. The influenza virus kills thousands of people every year, and it's a terrible disease. We do have a vaccine, and we have treatment to help with symptoms of people that get ill. The influenza typically kills 0.1% of people. Conservative estimates looking at COVID are saying 1% of people who get COVID will die, which is 10% times more deadly than what influenza is. So while the vast majority of people with COVID will have mild, limited illness, people who are older, greater than 70 years of age, people with heart disease, lung disease, diabetes, they're at much higher risk for death. And that's where this concern is. And that's where these measures are taking place. We're trying to limit the spread to vulnerable populations.
Absolutely. That was a good breakdown, too, by the way. Annette Sherman Heinlein writes, I'm wondering, with events being canceled, classes going online, etc., what should we do to protect ourselves when going grocery shopping, out to a dinner, a movie? We kind of did talk about this.
Right, and I think some of these are going to be personal decisions, right? If you have underlying health conditions, these may be events that you want to stop doing.
Right.
Get a ship shopper to bring stuff to your home. Maybe you don't go out to eat. If you're otherwise a healthy person, trying to maybe avoid the blockbuster movies, right? To stay where there's less crowds, maybe picking later or earlier times to go grocery shopping. I think, you know, there's people always talk about wiping down the grocery carts. That's not a bad idea.
Right.
But this virus, for the most part, again, it's spread through respiratory droplets. The environment probably plays a smaller role, or plays a significantly smaller role than what we see with people coughing and sneezing.
No, it really has to do with if you're out amongst people, that's
Who are
where it
sick.
spreads. So
Correct.
you need to just remove yourself as much as possible from that for a while.
Right.
Jeannie Carnes saying, I am worried that there won't be enough testing kits available to everyone that should get tested. What steps are being done to ensure testing kits won't run out?
Right. So I think one of the things that we're trying to do right now, tests that are being obtained are still being run through the state labs. So we're trying to be judicious with the number of tests that we're submitting. So people have to have appropriate symptoms and fit the clinical scenario of COVID before we're sending tests. So we're not just sending tests on everybody. So in some ways we're limiting the number of people getting tested to make sure the tests are available for those that become more ill. That being said, commercial labs are coming online with tests, and I would expect within a number of weeks there will be very limited to no restrictions in getting people tested.
Dr. Russ Lampen, thank you for that. That was
Thank you so
a
much.
sober assessment, no frills, clinical breakdown of what we should be doing just to stay healthy.
Great questions and so many answers right here. Appreciate it.
Okay, thanks for the
Doctor,
opportunity.
thanks for your time. And we have a lot more answers for you right now over at woodtv.com. You'll find the entire coronavirus section. We've got links to resources from the CDC. You'll find a story explaining the differences again in the symptoms between the flu and the coronavirus.